Hello class, my name is Teresa Allen. Welcome to my presentation on case management. What is the principle of case management? It is based on the fact that when an individual reaches the optimal level of wellness and functional capability, everyone benefits. The individual client being served, the client's family or family caregiver, and the healthcare delivery system, and also the reimbursement source or payer. Retrospectively, it could be considered that when the case management approach is not used in individual patients' care and optimal health and wellness is not achieved, everyone experiences a negative impact. The individual client, increased stresses upon the family and caregivers, increased burden on the healthcare delivery system, and increased costs across the reimbursement sources. Who could benefit from case management services? The following list of patients is by no means an exhaustive list of those who could benefit. These patient types include individuals with developmental, physical, and mental disabilities. For example, a severely compromised individual by an acute episode of illness, of severe and persistent illness, such as schizophrenia. The elderly, children and adolescents, long-term medical complex individuals that require multifaceted, costly care. Some examples could include HIV, AIDS, and hepatitis C. Where does case management fit in with the care of the psychiatric client? Case management approach is required in continued care for people with mental illness, their families, and the community. Utilizing this approach helps patients bridge the gaps that exist between the healthcare system and helps address any possible deficits related to their mental illness that may create barriers to receiving appropriate care. What is psychiatric case management? It is a process which assists the client to adapt to their mental illness through mobilization of appropriate resources to ensure quality outcomes. Many people with a history of mental illness have a complex array of needs that must be considered by psychiatric case management. How can a psychiatric case manager help? They can help by providing education to the client and family, wellness and prevention services during a crisis, and improving access to services to allow for a smooth transition for the mentally ill client along the care continuum. Who is the interdisciplinary team and what is their role? The interdisciplinary team consists of physicians, psychiatrists, psychologists, social workers, nurses, health coaches, and public officials. The individual members, each of whom possess particular knowledge and skill, come together to share their expertise with one another for a common purpose. The team is characterized by cooperation, coordination, and equality, the health and welfare of the client. What is the purpose of the interdisciplinary team? The purpose is to enable patients, their families, and healthcare providers to be actually involved in providing for ongoing needs. The team is recognized as the provider of holistic planning and treatment for mental health clients and a necessary forum for the professional communication, coordination, and accountability. What are some of the factors and symptoms the mentally ill client must face? It could be emotional and mental well-being, safety and safety of others, in terms of potential dangerousness to self or others, or just the inability to care for self, medication management and non-compliance, income and housing. These individuals have faced challenges to obtain and maintain their housing, physical health, and facing obstacles related to medication side effects. Some examples would be sexual side effects or foods that must be avoided. Substance abuse. Mental health problems and substance abuse problems are often seen together. One makes you more vulnerable to the other. Family support. Family is the cornerstone of mental illness sufferers during their treatment and recovery. Sometimes mentally ill people want support of their family, but other times they distance themselves. The mentally ill person perceives themselves as unaccepting or the outcast to the family. The other symptoms: anxiety, depression, paranoia, and psychosis. Case management must maintain and continue strong relationships with these individuals. They can help during a crisis-provoking situation, to develop individual care plans that include coping mechanisms that can be beneficial. And they can also provide phone calls to their providers to keep the individual stabilized in the community. Mental illness affects people of every race, class, and nationality. What is cultural competence? It is the knowledge, skills, attitudes, behaviors that are learned in order to provide the optimal health service to individuals from a variety of ethnic, racial, and cultural backgrounds. Developing cultural competence is critical to supporting mentally ill patients across diverse backgrounds, values, and behaviors. It is central to the delivery of patient-centered care. It includes awareness, respect for diversity, and acknowledgement of cultural differences. Through cultural awareness, case management can support clients and educate them about their healthcare needs in an environment they understand. I would like to share with you an event that takes place every year on Cape Cod, Mass. In October. It is the Behavioral Health Summit. It is a great clinical experience. You're able to gain insight into new research, learn of local-based initiatives, and it's an awesome opportunity to network with a wide range of healthcare providers. This program focuses on serving children and adults and their families in our communities. It looks at some of the largest impacts on a person's physical and mental health and what resources are available on Cape Cod to address them. It emphasizes education, communication, and improving access to services for individuals struggling with mental illness. The presenters speak out against stigma and try to debunk myths about mental illness. As clinicians, we know stigma continues to exist, and we have to keep working very hard to break down the stigma and stereotypes through better education and awareness to the public. In summary, in order for mental health professionals to provide case management, they must possess the education, skills, knowledge, competencies, and experiences needed to effectively render appropriate, safe, and quality services to our clients. It is significant for the mentally ill person to achieve the greatest possible degree of self-management of his or her disability and to reach the most independent and fulfilling lives possible within the community. Thank you very much for your time, and I hope you enjoyed the presentation. Please feel free to review references and works cited.